Disturbing findings about students and suicide. The new study is from the Southern California News Group and was given to 70% of 9th and 11th graders in California's public school districts. Over the last 4 years, data showed that 18% of 9th and 11th graders had suicidal thoughts. School districts that had fewer students experienced fewer suicidal thoughts, and they had a couple of things in common. They promoted suicide prevention training and prioritized community partnerships to bring in resources. Joining me to discuss the findings is Professor Ron Avi Astor from UCLA. Good morning, Professor.
Good morning. Thank you for having me on this important topic.
It's a pleasure. Some alarming numbers. What do you make of this?
Well, the numbers have actually been pretty stable over the last years. This is the first time that in our studies published in pediatrics that actually looked not only at individual children at 18%, but in the ranges of kids in specific schools. And what was specifically shocking for us was that we had some schools that had 4% kids with suicidal ideation, and other schools that went almost up to 70%. They were rare.
Wow.
And what that said to us is that there could be a school-based public health approach that actually targets communities and schools that have high rates of kids thinking about suicide long before they attempt, and then bring all the resources, do suicide prevention, help train the staff. And that's currently not done in a systematic way in California, even though the data exists.
In the schools that had higher rates of students with suicidal thoughts, did you find any commonalities? What were some of the elements?
Well, in this particular study, we had most of the middle and high schools in California. So this is a very large study. It's not a small one. And we don't know what they're all doing. And that's the big question that we have here. What we do know from other studies all over the world is exactly what you just said. If the school addresses it, they have social workers, counselors, but also connect with community resources, educate the teachers, and particularly work with the peer group, because that's kind of the engine that's getting a lot of the students to be thinking and actually to behaving in that way. They have friends that are also dealing with substances, difficult life circumstances, and it kind of feeds one on the other. So working with that peer group so they understand they're not snitching on a friend when they hear about something, but they're actually saving lives, they're supporting their friends. The best schools across the world do that kind of work, not only at the teacher level, not only with psychologists and social workers, but really work with the peer group.
So these numbers are certainly alarming for parents and school administrators. What can they do about this?
I think there's a lot that can be done from the parents' perspective and from the school's perspective. What we've seen from around the world in different projects, if parents and educators work together to create very welcoming schools and then build strong relationships with NGOs and mental health agencies and make sure that their district level have social workers, psychologists, principals who are trained and understand trauma-informed practices, but also suicide prevention around issues of weapons and what to do when kids tell them, then schools can make a real big dent in this area and prevent lots of suicide from happening. But I think one of the keys is making sure that everyone in the school, the students and the parents, are not isolated and alone or not connected to anything. And that's true in the lunch area, in the yard, and after school programs, and even online. So the school has domain in those areas and can work with parents closely so they don't feel alone as well and on their own with this issue.
It is certainly an important issue, Professor. We appreciate you shining a light on it. Thank you.